Well, good evening, folks. Welcome to Dentist in the Know. This is the podcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We're going to pull back the curtain on the industry, talk to the experts, the innovators, and the everyday clinicians who are out there doing work. No fluff, no filter, and definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical breakthroughs to regulatory curveballs to the latest scandal at the ADA, we're probably already talking about it. And yes, we're bringing the receipts. So whether you're a seasoned doc, a curious consumer, a rep, a researcher, or just here for the drama, welcome to the show. Because around here, we're not just in the loop, we're in the know. So folks, I'm Dr. Chad Duplantis, and tonight we have my bestie, Dr. Jennifer Bell. I don't know where our other bestie is right now, but he's just not here. So how you doing, JB?
I'm great. How are you doing?
You know, I'm doing good. I don't think it would be a wonderful evening on Dentist in the Know if we weren't having some sort of connectivity issue with StreamYard.
Yeah. Crisis, whatever.
It's one of those deals where StreamYard just hasn't been our friend lately. So we'll deal with it. We'll suck it up and we'll move on. You having a good week?
That's very big of you. Very big of you.
Yeah. Good. You having a good week?
Yeah, actually so far, okay.
Yeah.
I'm coming off coice. Like, how can I be bad?
How was that?
It was great. I'm sure you've seen all the posts. Everybody's posting about their infamous time at coice, but you know, if you peel back like one layer of that onion, it is a phenomenal time for us to all get updated on current literature. You know, we've learned certain like baseline principles, but then there's always new articles and things coming out every month. So we have to stay up to date on that. And lucky for us, Coyce has a team. In fact, Coyce does a lot of this himself, but he has a team around him. He's reading 20 journals a month on average, looking for any updates that might be relevant to dentistry. So they're not all dental journals, but they certainly would have anything that might have to do with medicine or caries development, systemic issues, all that kind of stuff. So it's really nice to sit in a room and just get the opportunity to review a lot of that literature for modification of your current protocols. You're in the room with friends. And I think that's probably if you know, Coyce has done a ton of things right, but if he did anything just right, it was the environment and the tribe that he built around his philosophy, that, you know, were ambassadors of the concept of, you know, scientific learning and evidence-based dentistry. But we're all friends around each other. I mean, it's just like being in this really big extended family, getting together and sharing stories, commiserating with each other about what it is to be in the trenches. So, you know, you can't underestimate. I haven't been. It was my first time going to symposium. I graduated in 2018. So that's the first year eligible. So just time, then COVID hit and all that kind of stuff. Man, I have so much regret that I didn't make that a priority before now. And, you know, the future of symposium and the future of this like annual meeting for us to all get together is a little unknown right now. But it definitely went out with a bang. It just was it was a great weekend to be amongst like-minded peers, partying and enjoying each other and also learning together. So it was really good.
That's
a lot of
awesome.
karaoke, actually. Yeah,
That's
oddly.
awesome. That's awesome. Yeah, it looks like there was a great time. A lot of our previous guests,
yeah. I mean, again,
can you hear me?
You're looking in a room. Sorry, now Rosie wants to be a part of the party. But you're looking in a room full of people that have been on the show. You're looking.
And then there goes Ringo.
Oh no, it's like a triple effect of dogs going nuts. Yeah, when you look around the room, you know, 30, 40%, and then some percentage of them have been on the show. So it's really cool. What was really funny though is how many people had
That's
been on
awesome.
the show, but had never actually met me in person. So they weren't 100% sure who I was at first. And they're like, wait, I've been on your show. And then, it goes from there.
Who was that? Just do you remember any of the ones that hadn't met you in
Well, the
person?
dental sommelier, right? When she came on and we did the whole
Okay.
wine show and stuff. Yeah.
Yep. Yep.
It
Okay.
took a few hours for that to all get pieced together. And then who was the other person? Somebody else had been on our show and Charles, who was on our show for the mission work. He was on with your business partner.
Yeah.
Had never met Jeff, and Jeff didn't remember that he was on the show. So I was like, yeah, Jeff,
Oh,
he's
geez.
been on our show.
I think Charles has been on twice, hasn't he?
Just once, I think, but.
Just once. Okay.
And then my buddy
Well,
Rob, who does all the virtual veneer consults, he was there. So that was awesome. Yeah, really cool.
Well, cool. Well, we have a great guest, Katie
And you're
Pudhorodsky.
frozen.
Can you hear me
I
now?
really think that you should pay your bill.
This is fun.
Yeah, you should really pay your internet bill. And now I'm alone. Oh, they should never let me fly the plane. But when they do, then I have full control to do whatever I want to do. So with that, I'm going to start the news.
As I was saying, do you have any news?
Of course.
So let me real quick just briefly mention our guest, because I may
Please.
not get to do this, because who the hell knows what's going to happen with StreamYard.
Yeah, it might be the last time you speak.
But Katie Pudhorodsky is going to be our guest tonight. She is a massage therapist. I'll introduce her formally in a bit, but I'm really excited about it. I met her at the TDA. Really excited to hear what she has to say. So without further ado, why don't you do some news and then we'll get to our guest.
Yeah, why don't you go pay your internet bill? Okay, here we go, guys. I do have some interesting news. As always, that's why you tune in every week, right? Well, we'll go ahead and start with the heavy hitting stuff first, and then we'll dive right into science. I'm feeling kind of inspired coming off of Kois. The dentist who was in Colorado who allegedly attempted to poison his wife over a series of 10 days by slipping some poison in her shakes is going to jail. Today, the verdict was announced. He was found guilty on multiple charges, and in fact, found guilty of charges beyond the crime about how he tried to coerce someone to murder one of the lead investigators and also tried to get his daughter to cover up evidence. Anyway, sounds like a real winner in my book, and he's going to jail. Sentencing is supposed to be sometime later today, which means it probably, because it's Colorado time, probably happened within the last hour or so. But absolutely going to jail, which I think is rightfully where he belongs. I'm not really sure he put up much of a defense. I think he just infected it. Like, this is one of those clear-cut cases, I think, unfortunately. And now I'm probably on his list. Okay, great. The next thing was, I was really hoping Jeff would be on tonight because I wanted him to be one of the first to hear this story, because I don't think he's seen it yet. The first pill that could be a curative agent for OSA, or obstructive sleep apnea, is in its third phase of clinical trial. So as you know, obstructive sleep apnea is commonly treated with either a CPAP or some type of oral appliance that your dentist might fabricate for you. But there's been this movement amongst pharmaceutical companies, and in particular, Apnimed, which is the one that's working on coming up with an agent that might be able to be in pill form that will help with sleep apnea. And I got to be honest, I was stunned. I never thought in a million years that it might come in pill form, that we could leverage some type of pharmaceutical to help solve OSA, but that's why I don't work for the pharmaceutical companies. Anyway, it is a neuromuscular modulator. I would assume it's intended to work a lot like Inspire, but without the electrical connectivity, to stimulate the muscles of the pharynx, the tongue, the posterior airway, to keep them open, or to respond when an obstructive event is starting to happen. They kick in to open it back up. It is in its third phase, and at least currently, the data is looking pretty promising. Those OSA patients that were treated with the medication saw a 50% reduction in the severity from baseline at 26 weeks, compared to 6.8% in the placebo group. That is a significant reduction in OSA, and it seems like this might have some legs. So the study is going to continue on for 51 weeks, so almost a year. They will get some additional data and they'll put it all together. And I guess we'll see if now this medication gets approved for OSA and will be amongst the other options that we have to provide to patients. My internal instinct is to be a little bit skeptical about the new medications that come on the market that might be able to cure an obstructive sleep disorder. Unlike many of the other types of disease processes that we treat with pharmaceutical agents, this is an actual physical obstruction. Like if a piece of steak got stuck in the middle of your airway, and they can't breathe. So I am genuinely curious. I'm hopeful and optimistic, but I'm also healthily skeptical at the same time. I think it can be all three, right? I think that's fair. The third story for tonight is yet another new product that might be coming on the market. Could you possibly get your vaccinations through floss? Well, there's absolutely a company trying to make that happen, to be able to floss your vaccines so you don't have to be bothered with going to the doctor anymore for those pesky injections. Now, what I want to make sure is that that's a fully disclosed technique, right? We're not going to be sneaking any vaccines into our floss, but this could be the first needle-free vaccine that we've seen. There has been good data coming out of this study as well, showing a high rate of inoculation occurring. If you think about it, floss is going straight to the gingival tissue, which has a lot of vascularity. If you preload that floss with a lot of, attenuated viruses or dead viruses that you want to replicate in the system so that your immune system will make a response, I mean, it could be a really great way to start introducing vaccines. Now, of course, my brain immediately goes to, okay, is this something you can buy over the counter? Are we going to be able to get over the counter vaccines at that point? Are we going to have to go to our pharmacy to get our floss and then get our vaccine? And then the third thing that you can't ignore, the elephant in the room, how many patients actually floss? Honestly, how many? Is this really the best mechanism? Now, if you put in a chocolate bar, it probably would go bonkers. But floss? You pick the one thing that like only 10% of Americans actually do, then you put something maybe life-saving stuck to it. I don't know. I would love to think the vaccines could be administered in a painless way. It would really help me when I see the 3-year-olds that have already been inoculated so much they hate anybody in a white coat. Get it? Would love it to be in floss. But I'm also slightly skeptical that the average human not already flossing would actually leverage the technology for good. And with that, that's the news. Okay. Now, I'm really excited to introduce our guest. Chad met her a couple of months ago and was really fascinated with her journey, also really fascinated with the care that she is providing to her patients. And it has only been within the last 15 minutes that I found out that in the late 70s and early 80s, we likely were standing in the same places at the same time, which is pretty fascinating to me. But Katie Pudhorodsky is joining us this evening. She's going to talk to us a ton about TMJ and physical therapy associated with that disease process. And for most dentists, that's a real bane in our practice, trying to help patients get pain relief and find modalities that can get them to a comfortable place. We know there are many that exist, so I look forward to diving into that a little bit more. But Katie is a structural massage therapist in Austin, Texas, with over 22 years of experience and specialty in training muscular sides of the head, neck, and jaw pain. She collaborates with dentists, ENTs, and myofunctional therapists to help patients experiencing TMJ, dysfunction, clenching, headaches, and facial pain. Her online platform, Help Head Pain, offers self-paced video courses designed specifically for the layperson, teaching safe, effective strategies like self-massage, stretching, stabilization, and how to identify perpetuating factors that may be driving pain. She's been featured in WebMD, and she contributed to the TMJ Trifecta, a book authored by TMJ-focused dentists exploring collaborative, multidisciplinary care. When she's not teaching or in session, you'll likely find her tending to chickens or harvesting veggies from her community garden plot. Katie, I am so excited to welcome you to the show. Thank you so much.
Thanks for having me, guys. Welcome back again, Chad.
Yeah, I'm not even going to get attached.
Switched browsers, and I'm not going to say anything, but it was completely different when I opened it. So that's all I'm going to say.
Okay. Yeah, maybe just don't say anything.
Did y'all hear that?
Yeah. Most of it, like 90%.
Okay.
Statistically higher than your current average. So,
more than people floss is what I just learned.
Yeah, for sure. More than people floss.
All right.
And like,
okay,
I'll say
y'all go,
30% lie about flossing. So just, they don't want to get yelled at. Chad, do you want to talk about how you met our guest?
Can you all hear me?
Yeah, we can.
Okay. Well, if I cut out, I apologize. I don't know what the actual hell is going on, but I'm trying to figure it out. Anyhow, I was at the Texas Dental Association meeting in the beginning of May, and we had a what was it? A speaker reception, scout reception.
I think so. A social.
And we both kind of walked in there and looked around like we didn't really know anybody there. So naturally, we just started talking, and she told me what she did. And I asked her to be on the show. And honestly, I think she thought I was like joking with her or jacking with her or whatever. She was very hesitant at first. And I'm very glad that she agreed to, because I think what she does is such a necessity for dentistry. I really wish that Jeff was here tonight, because it's just such a fantastic topic for him with what he does. But I truly believe in the power of massage therapy, and as well as physical therapy, as well as chiropractic care. I have no problem with any of those, but I really think that a lot of our patients need a really good massage therapist, and somebody that knows what they're doing in the head and neck region to help them with their joint, neck pain, headaches. And when I started looking at Katie's bio, it's like, yeah, she does all of that. So this is awesome.
Yeah, I even went to physical therapy training to get a piece of this puzzle, and but I also really believe, as we'll chat about it today, that that people can do a lot of this work on themselves, for themselves, by themselves, and it makes it really affordable, but they need to be well educated on it. Experiencing it with, and in conjunction with a manual therapist that's trained in that advanced TMJ work can be really important, but I think there's a huge piece that can be done for themselves. Mm-hmm.
I have a very technical question, or actually a very legal question. Is it from state to state? Like in North Carolina, you have to have a special subspecialty in TMJ massage. Is that fairly consistent amongst all states, or is it very sporadic and different?
Well, I first got licensed in North Carolina and then moved to Texas to work. So I know familiar with both of these two states. Mm-hmm. And it's only recently that I learned about a few weird states with TMJ work. My understanding is that if you're properly trained to be able to execute this technique safely, you can do this work. But then I learned through some other massage therapy TMJ groups that some states you can only do it under a dentist care, or with a referral. So I don't really get that. And if ever I move, that's going to be my research question and limit me to where I can move.
Yeah.
Or I'm going to have to do a lot of fighting.
Yeah.
So that brings up a question. tell us a little bit about your practice that you work in, or the facility that you work in. I apologize. I don't know what that's called. Are you with a group, or are you by yourself?
It's just me.
Or?
I'm a solo practitioner. So yeah,
Okay.
let's see, of my full practice, about 70% of what I work on is head, neck, and jaw. So that includes headaches, jaw pain, movement dysfunction of that, just neck and shoulder issues. A lot of those patients are clients in my world. Clients start with me for that work and then stay with me for other work, or we do blended work and we do a little bit of maintenance on the jaw or the neck for headaches, and we get to include other body parts as well, either for pain relief, for keeping the upper stories looking right, maybe addressing the low back imbalance as well. So we just adjust it as our relationship develops. Because I've been practicing for 23 years and have a history with even teaching and being an assistant at a massage continuing ed program. So I've got quite a diversity to pull from. It's just the TMJ work that has set me apart in a unique niche.
Do you typically work with from a referral?
How do you get referrals? Okay.
We're going to ask the same question.
Great. I'm glad it's the same one. It's hard to answer two at once. I have a lot of dentists in town that refer to me. I've got some ENTs. I've got a really great endodontist that recognizes it. And so his pattern is someone comes in mainly because they're sent from a dentist to the endodontist. He can do the appropriate scans. If he sees that everything is okay, or if it's just low grade enough and they're like, we need to just watch this, then he can do some palpation, because most likely they got sent into him because it is a tooth pain. So he'll do some palpation and squeeze on, let's say, masseter. Masseter can refer into the molars, upper and lower. And if he squeezes on that and the person says, oh, that's really tender, or, hey, that turned on my tooth pain, then he can say, I bet it's a muscular thing. I need you to go see Katie and do what she says. So, so that's a unique and thing that I think needs to be tapped in a whole lot more. I would also like to see a lot more, let's say, periodontist. So anybody that needs to be in the mouth for a long time, or someone that needs to get a lot of gum work done, to be sent, if they know they have jaw problems, to be sent for getting work done before those big procedures. And then a lot of people, honestly, here are a few other ways that people find me is through Reddit, because people go to outsource information from the general population in their city. TMJ Massage Austin, TMJ Massage Therapist near me, things like that, of just people are searching on their own because they're not all people are given answers at their dentist, or they don't think that their dentist is going to serve them because they've never talked muscles before. So a lot of people just go at it at their own, and they come across me or someone else if they're lucky enough to have someone in their city.
So if a dentist has a patient that comes in that is, super tight, they're not able to even open for procedures, like they're trying to get in to even do a filling or, whatever, and they feel almost locked up. Like, what are some of the things dentists should be looking for? And then how does massage therapy play into that?
So some signs that someone could have some TMJ issues, starting first at the joint and then going wider than that. We're going to have some sounds in the joint. Could be as easy as sand in the joint, gravel sounds, grinding. Then there could be some movement dysfunction of that jaw opening, popping and clicking, locking, a limited amount of opening. That can also change into how their occlusion is when the teeth don't fit together properly and that mandible is pulled over from muscles. You're going to see that in those teeth. So I see that. I look at people before and after our work, and that occlusion improves for some when it is a muscular thing. Okay. So other things that you're going to see, taking it outside of just sort of the joint area, they could have a lot of pain in the lower face, in the jaw area. They could have headaches and temple pain coming up through the head. Taking that behind, we're going to have some ear issues. So TMJ issues, and we're talking muscular trigger points too that can refer into these areas. And also then just structures pulling on each other. So we've got a few different things that we're looking at. So the ear issues that can show up, fullness in the ear, an underwater feeling, ringing in the ear, a loss of high pitches, itchiness, burning sensation, those kind of things might show up ear. Teeth-wise, we went over that just a little bit. Muscles can refer pain into the teeth. It'll be something that'll come and go. And headache patterns above the eye is very common, coming from the jaw or the neck. Headaches with visual disturbance. That's a great one coming from SCM that can easily be addressed. Then we get to think about like what is their use that they're missing out on? So fatigue, eating, chewing and talking, singing, making out with a partner. I would love to see more dentists ask their patients, hey, can you do what you want to with your mouth, with your partner? Because that's when you'll learn that they need some help. They don't want to live that way. And then things can fall down and things can come up from those TMJ issues. So if you guys have any more to add to that, I'd love to hear it. But then I also want to hear from you too, like when someone has this list of problems and you said, JB, like limited mouth opening, how does that affect your day-to-day practice? Are patients saying, no, I don't want to get that procedure, not now? Does it change your day-to-day workflow, put things behind? What are you guys seeing, or did you see in your original practice when you first started and didn't niche in?
Chad, is it okay if I answer first?
Absolutely, please,
Yeah,
because I don't know if you'll hear me.
Yeah, that's fair. That's why I figured I might as well jump in, and then if you try, then we'll pretend that you're actually talking. Mm-hmm. For me, when patients present with challenges within this oral facial space, the first question I always have is, am I dealing with an anatomical problem? Like there are past traumatic events, they fall, break a condyle, it gets underreported. Like there are things that can happen to the TMJ space that are anatomical in nature. And if we don't address that, like a bad knee or a bad shoulder, massage therapy, acupuncture, Botox, like all those things are going to make them feel better, but it's all transient because the origin of the diagnosis is off a bit. So for me, it's always trying to figure out, am I dealing with an anatomical problem or am I dealing with a muscular and occlusion problem? And they typically fall in those two buckets. So if we're dealing with an anatomical problem, that's out of my scope, and that's off to Jeff, and that's off to folks that do MRIs and really look at the joint space. And how that translates to us in practice is it is limited opening, and it does mean there's the possibility we can't treat certain things because we physically cannot get to second molars. We can't get to off surfaces where our hand pieces have not either been designed or just simply won't fit in a safety. We're trying to manage soft tissue and not getting anywhere near the floor of the mouth and not getting cheeks and tongues and lips and all the things, and not choking patients. So we're balancing safety and treatment modalities and then origin of disease and trying to put all those pieces of the puzzle together. If it's occlusion and or neuromuscular issues that, the joint is healthy, it's just all the supporting structures that are having the issue and may or may not be contributed by a poor bite or a setup of occlusion that's not really working well, then we go down a new pathway and we start really trying to work on deprogramming all of that information, working with our specialists that we refer out to, physical therapists, massage therapists, chiropractors, even for some folks that already have those relationships, to try to help kind of deprogram some of that information. But we're also doing that clinically as well, because at the end of the day, we're trying to make sure that the teeth and the mouth actually fit the face and the way the face wants to be postured. So it's this whole multidisciplinary, complex approach to trying to help these patients sort of unravel, often, as you probably see, years of discomfort, pain, not being able to do the things, kiss their partners the way they want to, eat carrots, chew bagels without clicking and popping and all the crazy stuff that's going on. So for us, it's very complex to try to unravel, but go back to etiology to try to understand how we got here, and then how do we support them down the pathway. And then you probably see this too. It really comes down to what the patients want to do, where their path kind of leads them to go. So I may present 22 different options, and they're going to choose which one fits their lifestyle, which one fits their, psychology better, which one fits their modality of how they think about disease and medicine. Like, they ultimately start picking their paths, and some pick Botox, and some pick massage therapy and acupuncture, and some pick going through orthodontics and full mouth rehab. Like, it just kind of fits different buckets. And, we're just kind of here to support and provide the options, and then work with great people like yourself to meet patients where they are and kind of help them get better.
Yeah, and I think that
long-winded.
I think that knowing the options is one of the key things. I've worked with, or I've gotten the stories of clients that came in and of someone who their teeth weren't fitting together, and they had this grinding sound in their joints. And he's like, well, I can give you two options. One's Botox, and one's you go see this massage therapist that I know and refer with. And she's like, I didn't even know that existed as an option. So I think that's one of those. And I think it sounds like you were willing to give out these options, and knowing what's in your community as a dentist that you can offer.
Yeah. And to your point, you really have to, sorry, Chad, just really quick. You have to find those massage therapists that have that in North Carolina, that have that subspecialty. Like, I can't just.
Oh, you can't go to a general.
Go to a regular massage therapist.
No.
We have a few that we refer to that we know have that niche specialty that will participate in that global care.
Good.
Yeah.
Yeah. So one of the things that I was going to ask you is that you mentioned something about people not having their teeth fit together appropriately. After you've worked on somebody and you've kind of found their stability muscularly, or you've got them relaxed, do you find that patients leave you and then they're like, my teeth don't fit together now?
No, it's the opposite. I have more chance that they come in and I'll have them sitting upright and test the occlusion or the bite strike, have them touch their teeth. And like just 2 days ago, a person said, since I got hit in the face with someone's elbow playing basketball in high school, I haven't been able to get my teeth together. She's like, I can get my right side together, but not my left side. Or I squeeze really hard and the left side can touch. Or I can try really hard and get the one side and then I can't get the other. And so then first session, we do our work treating the neck, the external jaw and head, and then the intraoral TMJ work, including the medial and lateral pterygoid. And then after the session, right back in the chair, same position. Tell me how those teeth touch. Like, I have no idea. If it's a muscular side, it's going to show us some things. And she's like, I haven't had my teeth touch since I was in high school. She goes, and my jaw hasn't felt this good since I was in high school. So, we can have, and to sort of tie it into something that JP was saying, is that, is it an anatomy thing? Is it a muscular thing? You can have both. You're entitled to more than one problem and more than one pain. So, and that body work can help give data to, is this something we can work with, and how far down that relief do you want to get, and can prep you up to get the other work done as well. So maybe, Chad, what you're thinking is that, you can, if we can address the muscular side of, so lateral pterygoid and masseter is really pulling you to one way, and we can take out the muscular side. Now the dentist is set up to stabilize the bite and to adjust anything else that needs to happen. so that they can maintain that. So this is where I just get to, help you guys do what you do best. And we need the patient, the client working on these things for the maintenance.
So you answered my question in a roundabout way, where we were both kind of saying the same thing, just kind of coming at it from a different approach. Where what we see a lot of times, and JB, tell me if you've seen this too, I'm sure you have, is that they've developed such a malocclusion from parafunctional habits and whatnot that their muscles have adapted to their malocclusion. And when you get everything kind of stabilized from a muscular standpoint, they feel like they can't get their teeth together, but we know that they're where they need to be. And so that's where the orthodontist or kind of a full mouth rehab comes into effect, that we've got to stabilize them either restoratively or through orthodontics. And so
so you guys pick up that piece. I clear out the muscle side, and also clear out those parafunctional habits, because we're chatting. I have the time to chat with them about this. And then you guys do that next step to stabilize. Some people need it, some people don't need it, right? So depends on what type of people you're working with.
So
do you know an orthodontist in Austin named Nick Salome?
No, it does not ring
Orthodontic Arts. I really want you to meet him. He's a brilliant mind, and he's somebody that I think would really dig what you're doing. So sorry.
Thank you.
Is there anything that patients can do before they come in to the office to make their experience a little bit better related to opening and jaw position, et cetera?
Yeah, I call that prehab, prehabilitation. So we're used to rehabilitation, what you do after a procedure, right? Like after we have a knee surgery, then we have rehab. So prehab is before. So prehab can look like working with a manual therapist. So that's working with that soft tissue from a massage therapist or physical therapist. It can also look like doing a lot of self-treatment for themselves, self-massage, stretching, maybe it's a little stabilization, definitely using heat on those muscles to soften them. All that can fall under prehab. So, and the prehab can help them address that medical anxiety, because they're going to aid in that participation in their own care. Prehab can also help to make that opening wider, so that, and make it a little less painful too. And that's going to let you guys get in there, like you were saying, JB, to do your work, to see what you need to do. It'll also reduce that strain on the muscles and prevent some joint injury. Let's think of trying to get a wisdom tooth out on the back bottom, right? So that's a lot of pushing and a lot of torquing of the mandible. So we need to make sure that those joints are in their best place. When we're doing these kind of manual therapies as well, whether it's from a professional or self-care, they're getting to address the muscles, the nerves, the fascia, the emotional nervous system. We'll add that one in there, and that lymphatic system. So they may even be able to aid in with these kind of things in that post-operative care of being able to get a little better. Some people need this for just something as simple as a dental cleaning. If you have somebody that only has like a 22 millimeter opening, they may need a little bit of prehab before. What I think is really important, though, is that I want to bring up to your audience of dentists, is that the individual doesn't know what this is. And so it's important that the dentist or hygienist, or if you're getting really good, that the front desk staff who is scheduling the appointment has the conversation and sets them up for success, because the patient needs to know what to do, who to go, or what to do on themselves. So before that session, so information needs to be passed along and suggestions need to be made so that they can have an easier time.
Do you do anything preoperatively, Chad?
I usually have them smoke a J if they need to. No.
Yeah. Right.
I really don't. I probably should. I love what you're saying, but if I have somebody that's got a lot of joint issues or muscular issues, you know, I mean, it's probably not what you want to hear, Katie, but sometimes I will give them a little bit of methocarbamol a week before just to help
Yeah.
relax them.
And this is where, so now you learn that there's more options, right?
Yeah.
And you get to ask them, hey, do you want this one? Do you want that one? Do you want both of them? It is totally fine. Some people want to know, I didn't know that I could do something and that it could last a little bit longer, right? That relief of the muscular thing. Oh, nobody told me that these muscles had anything to do. I've got some people that are like, Katie, I didn't even know my cheek was a muscle. I had no idea. I never thought of this. And I'm like, that's okay. Like you didn't go to face muscle school. It's okay.
I will, if I have somebody that comes in really tight that I'm going to fabricate a night guard for prior to doing, after I do my initial examination, I will place them on methocarbamol for about a week before I'll even take impressions. And I find that helps me a little bit better to get their appropriate position and the night guard fabrication. But to be honest with you, one of the things that I will say as a practitioner, I work a lot with a physical therapist, for joint issues. I wish that I knew of a local massage therapist besides the one at the physical therapist office who's fantastic that did what you do, because out of all the referrals that we make, the easiest referral that I have in my practice is to the physical therapist.
Yeah, and they're grateful for it, right? You're total hero.
They are. And the thing is that, a lot of what we do, even though we like to proclaim that it's minimally invasive, and it truly is, but talk about minimally invasive, physical therapy, massage therapy, chiropractic care are really, there's no, scalpel involved. There's no anesthetic involved. There's just a lot of working involved in a lot of manipulation, and it's all for the better. So patients are very receptive to that. I do have a question. You mentioned something earlier, because I get asked this a lot, and I may have kind of an old school opinion on it, but what are you all, I'll ask both of you this, what are your opinions on Botox for pain, for facial pain and joint pain?
So sometimes, depending on my client that asks, I'm like, so did you just ask me if I think it's safe for you to put a neurotoxin beside your brain and your thyroid? Is that the question that you just asked me? So sometimes, like, that's the thought that I think of for my own body. I think that Botox won't be very helpful if you're still doing the same perpetuating factors, if you're sleeping on your stomach, if you're only chewing on one side because you didn't fix your teeth on the other side. And, we can do the whole list of perpetuating factors. So it's not going to undo this other thing. The other thing I love to point out with Botox is you can only Botox temporalis and masseter. So now we haven't gotten medial pterygoid. We haven't gotten lateral pterygoid. Lateral pterygoid has attachments onto the front side of the disc and the head of the condyle. If that one's in spasm, it's pulling that condyle forward. It's pulling the disc forward, not allowing it to recapture. So we're missing out on a great opportunity to get that disc to recapture if the retrodiscal tissue is healthy enough. And Botox won't get that. Again, wish Jeff was here. I'm glad I got to pipe in on that one. So if Jeff was here and he said you had someone with obstructive sleep apnea that was undiagnosed, you gave them Botox. Now you've turned off of their saving muscles because the jaw has been thrusting forward to open the airway and move the tongue forward. And so you've turned off that muscle to save their life every night. So what may be recruited then is that medial and lateral pterygoid of like, let's just try to see what we can do. Let's just keep her alive tonight, everybody. So you're going to recruit more muscles that don't have that job and that could break down a little bit easier and have longer history of dysfunction. So I can support people's decision to do Botox because it's their body if they're given other things to adjust. And if they've tried if they've given the education. I don't think everybody's giving their patients the education. They're only giving that as a solution, which again goes back to why people are finding me on their own on the internet.
So interesting. I love everything that you said.
Good. I'll get off my soapbox.
It really frustrates me because I have patients that come in and before they've tried anything or understood what's going on, they happen to go get fillers and Botox and mention that they've been having jaw pain. And so some esthetician at a spa is injecting them with Botox. And so, I love the neurotoxin next to the brain idea, although that might be the pot calling the kettle black. My forehead looks really good, doesn't it?
Yeah,
but
it does.
But the thing is that there's to me, it's just a Band-Aid. It's a Band-Aid and it's a temporary fix. If you don't address, what's really going on, you're just going to keep doing it to really no avail. And not getting to the root of the problem, if you will. I don't discredit people for providing it if they're a practitioner and understand what they're providing it for. And I don't discredit people for taking it, like you said, so long as they've been given, the answers, the potential solutions, and the cause to the problem. So they're educated on what their needs are, So.
And JB, you're my news lady. Is it still not approved by FDA?
Actually, Botox and Xeomin are approved for masseter and temporalis, but all other neurotoxins are not. Don't quote me on that. I just saw a study, or I just saw a slide this weekend. If there are 5 or 6 neurotoxins on the market currently today, Botox and I think it's Xeomin are the only 2 that actually have TMJ clearance through the FDA.
I'm gonna have to look it up again. Good.
The other 3 or 4, like Dysport and some of the other ones, are only cleared for T-zone or the 11s. 11s. They're only cleared for the 11s.
Interesting. Do you have so I when I was cutting out earlier, and I'm probably cutting out now, I don't know.
No, you're good.
When I was cutting out earlier, I was asking you, do you have a website that we could direct our viewers to that I'll post right here for your videos and whatnot that you were talking about?
So my hands-on practice in Austin is kattiemassage.com. And then I have 2 online video courses at helpheadpain.com. And so that is for the layperson to learn how to do self-relief and to treat the muscular side of their head, neck, and jaw pain at home. So specifically the muscular side, because that's my scope of practice, right? Do you mean to get into the 4 pillars that I walk each of those 2 courses through of that foundation?
Please.
Because I think that'll be really helpful for dentists to understand some different ways to add in and of what you guys don't have the time for at the chair side that someone like the physical therapist you refer to or a massage therapist can have in that conversation. So and these are how I structure both of the online courses. So the 4 pillars to achieve and maintain relief in the head and neck from the muscular side. 1 is going to be to relieve those trigger points, to soften those tight muscles. That's going to be through massage and stretching. Then pillar 2 is to stabilize the joints, to ask the lazy muscles to participate and come back. So that way we can have smoother motion. So that's more exercises. It's more jaw tracking exercises. And then the 3rd pillar is going to be for proper tongue placement in the mouth. It's based on a lot of the myofunctional therapy, tongue up, lips together, and teeth slightly apart. So this encourages airway breathing through the nose to get the nitric oxide and having that tongue to rest on the hard palate to expand that as much as, or at least to support that, support where you are. And then that 4th pillar actually is one of the more fun ones that I like to get involved with my clients is looking at perpetuating factors that need to change. So perpetuating factors, things they're doing, things that just exist in their bodies, things they're not aware that they're doing. So things that are pissing off the situation, perpetuating the problems. So this could be a great example of this one. I had a trombone player. So he played for the symphony. You can tell it's a lot of mouth. It's a lot of tongue work. And you would think that that would be his perpetuating factor to his jaw pain, but it wasn't. His perpetuating factor was actually that he would put his tongue out and lick his mustache from the midline to the right multiple times a day for many years, so much that his friends would make fun of him. So his perpetuating factor was thrusting the jaw forward and thrusting his jaw to the right multiple times. So we had to recognize it and then give him something else to support. So we used the pillar 2, the tongue tracking exercise, to give him something to replace it with. Other perpetuating factors, sleeping positions, where you eat is huge. The fact of how you chew, one side, both sides, why you might only chew on one side. So I get into those kind of things as well. And that gives me a good place to refer back to the dentist to, hey, you need to get this taken care of because you're strengthening only muscles on one side. So that's the quick summary.
That is pretty awesome. And there's so many things that we've learned along the way that I heard you say, just little tidbits. And so I can tell that you really know what you're doing, which is just amazing. I wish you were in DFW area, but is there a
That's where those courses come in. Thanks for setting it up. Yeah. Where people can learn a lot about this at home and get that started, right? So that they can either bring things up to you as the dentist, like, hey, I'm doing this thing, or I realize I'm not chewing on both sides because food gets stuck over here. So then you get to make a plan, or you get to fix the problem, or you get to sort of have them do an agreement of, well, then I need you to floss right after every meal and be willing to eat over there, right? How's that sound?
That sounds fantastic. Is there like a list, like if somebody needed a massage therapist with your skill set close to them, would you happen to know people around the United States? Or
no, I would not.
Really?
No, because we're not all trained the same.
Okay.
I would look for someone that's trained in neuromuscular therapy. So it's trigger point based. So a lot of pain referrals, thinks about movement limitations with when muscles are too tight. And then you have to find somebody that has TMJ specific practice. For me, I've even gone to physical therapy course of a continuing ed. I have been a table assistant for a continuing ed program that taught TMJ as one of their courses. I've done a webinar on of watching, not leading it, but a webinar on TMJ and airway dysfunction, sleep apnea. So of looking at that cadaver and seeing what that is inside to really get that concept. So I think there are other people that are just as crazy passionate about this niche. And I hope that everybody gets to find one or can learn a little bit about how to care for themselves.
When are you speaking again?
Today. This is all I've got on my books. I get to go back in and really work with my clients and doing a little bit of writing and getting a few blogs out, and hopefully get back on my email list and be putting a little bit more on my Instagram page as well, trying to upgrade my stories of teaching in there, and YouTube pages.
Do you do webinars?
That's pretty much that webinar option would be to the layperson of those two video courses. I'll go ahead and offer though to the dentist. If you go to kattiemassage.com/doctors, and that's with an S at the end, you'll put it all in the show notes, I'm sure. there is a free lunch and learn that anybody can get and share with their dental practice. It's going to walk you through, I think maybe I've got 5 muscles in there that refer headaches and jaw pain. So SCM and all of our TMJ facial muscles. So what those trigger points can show up so that you can think through, oh, they're having pain in the joint. Maybe that is coming from lateral pterygoid. And so they can palpate it, or they can just see if, do they have other muscular pains? Let me refer out, or let me find a way to treat this within their, with what they know. So that free lunch and learn, share that with your team.
I'm thinking there might be a webinar in the future on Dentist in the Know if she was interested. Wouldn't
Yeah,
you think so,
I
JB?
agree.
Let me know. Let me
That's
know.
what I'm thinking. So
You know how to email me.
yeah, we do. And I really appreciate your time this evening. I mean, as we come to a close, there's so much valuable information. I really am sorry that Jeff didn't make it. He is not one to just not show up. So I know there's a crisis in South Carolina for him. So he would have really nerded out on this, and I know that he will be rewatching it. But we will be in touch, and we'd love to have you back at some point in time in one capacity or another.
Thank you so much. Can I tell everybody how to find and follow me?
Please.
Absolutely.
We went over those 2 websites, and they'll be in the show notes. Instagram, help_head_pain. So help head pain. And for the layperson, that help head pain, there's a free video on that one that they can get that's directed to them. So dentists, this is where you send your patients to. They can get that free video, figure out if that's the right solution for them if they have a muscular side. It's going to teach them about the trigger points of masseter, how they can show up as a headache, tooth pain, ear issues, facial pain. They'll learn how to do some self-massage externally for masseter. And then I'll teach them one habit they can change tonight. That way you guys don't have to teach this at your chair side, and you can just talk to them about dental care. So they can start with that. If they want to purchase a course, I'm going to give you a coupon code that anybody can use, DINKS, DINKS, and they'll get $20 off of either course. So take advantage of that. And you can find me through all those different ways that we mentioned before.
Awesome. Well, I am posting right now your link tree, and we will make sure that that's in the show notes as well. I posted the other sites that you told us about, the Katie Massage and helpheadpain.com. And it was helpheadpain.com/doctors that gets you the free lunch and learn.
Yes, you've got it.
Awesome. Well, thank you so much for being on here. I apologize for whatever the hell was going on my end. But
that's okay. You cleared yourself up.
The hamsters really got kicking in. They were running the electricity for the last hour.
I don't know. I just have to hold my head and pray. I don't know. But
yeah.
Anyhow, everybody, thank you very much for joining us tonight. Please look up Katie. If you have any massage issues or are looking for a massage therapist, I can't tell you how much it helps our patients. Totally minimally invasive care that can really benefit your patient population. Neuromuscular approach, as she discussed. And we just want to thank you for your time and for being here. And thanks to all of our listeners that are either listening live or to our recorded show. And we will see you all next week. Thanks very much.
Have a great night.
Thanks for having me. Bye.
Thank you, Katie. Bye.
Another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.